How to control hypertension without medicine. First, let me reassure you that high blood pressure is a very treatable condition. It is possible to slow it down or even stop it with a proper strategy. And this video will teach you a ton of knowledge to help you do just that. There are some simple and unbelievably effective ways to control hypertension that most people don't know or apply. This video will be a bit on the longer side because a short video that skims over the important details will not do justice to this important topic. Your blood pressure medications may require adjustment as a result of these changes. That's why it is crucial to collaborate closely with your doctor as you implement them. First, it is vital to diagnose what is causing high blood pressure. 95% of cases are labeled as primary, idiopathic, or essential hypertension. That means we get it without an obvious reason or a known medical condition. But there is a trail of events and a sequence behind how we end up with it. Secondary hypertension accounts for only 5% of cases due to a known medical condition. Some people have more advanced vascular disease and need help with blood pressure medications. But the information in this video will still help them avoid their side effects by reducing the dosage or number of medications they are already taking. I am going to give you a complete step-by-step protocol. So grab a pen and paper and get ready to take some notes, as there is a lot to learn. If we broadly classify the factors that contribute to hypertension, the primary players are metabolic and neurological mechanisms. The neurological part is regulated by sympathetic and parasympathetic components of the autonomic nervous system. When the parasympathetic portion is dominant, it facilitates calm, rest, repair, digestion, immunity, and reproduction. The sympathetic aspect, on the contrary, prepares the body for emergencies like fight, freeze, or flight response. This is achieved by increased heart rate, high blood pressure, and more blood flow to the muscles and extremities so the body is ready to fight or run when there is a threat, be it an actual or imaginary one. Anxiety in day-to-day life is also one such red alert for the mind that triggers a sympathetic response. The good news is that the neurological component can be reset quickly through certain practices, although we need to continue those practices until the parasympathetic drive becomes dominant and automatic. The metabolic part results from long-term unhealthy dietary and lifestyle habits that cause insulin resistance, inflammation, oxidative stress, nutritional deficiencies, stiff arteries with age, arterial plaques, metabolic syndrome, and complications. Metabolic reset, on the contrary, takes time to take effect from weeks to months, the earlier the better. First, we need to stop doing what has caused us to have metabolic syndrome in the first place. This is our not-to-do list. Second, we need to make up for the nutritional deficiencies and replace old unhealthy habits with a healthy diet and lifestyle. This comprises our to-do list. We are constantly abusing our bodies unknowingly, and we have to apply these modifications consistently to prevent further damage. Most people with chronic health issues lack essential nutrients that can cause, mimic, contribute to, or even worsen various diseases. And high blood pressure is no exception. Symptoms of nutrient deficiencies, like anxiety, depression, and irritability, can overlap with blood pressure and heart disease symptoms. The most common deficiencies that cause high blood pressure are vitamin D. Low levels of vitamin D can lead to elevated parathyroid hormone, increased risk of arterial constriction, calcification, and high blood pressure, hypertension. Heart failure patients with low vitamin D levels are also at greater risk of death. Therefore, it is important to maintain optimum levels of vitamin D to promote good cardiovascular health. Health tips. Get your D levels tested and optimize them to at least 80 nanograms per deciliter. Vitamin D deficiency is more common in brown or dark-skinned people. B vitamins. Low levels of B vitamins such as B6, B9, and B12 result in narrowing and damage to the lining of blood vessels, which can ultimately result in hypertension. Therefore, it is important to consume adequate amounts of B vitamins through a balanced diet or supplements to prevent deficiency and maintain a healthy cardiovascular system. Magnesium. When there is not enough magnesium present, the pumps in our cells that help move sodium and potassium around stop working properly. This causes too much sodium and calcium to build up in our cells, but not enough potassium. This can cause constriction of blood vessels and high blood pressure. Low magnesium also causes palpitation, anxiety, night cramps or cramps at rest, numbness or tingling in the legs or hands, and headaches. Magnesium is an essential cofactor for vitamin D. Without magnesium, our body cannot properly use vitamin D. Magnesium also protects against clot formation. Health tips. A simple blood test cannot pick up a magnesium deficiency as serum magnesium levels are tightly regulated. The best test for magnesium deficiency is to test magnesium levels in red blood cells. People with high blood pressure may need anywhere from 500 mg to 1,200 mg magnesium per day in divided doses, or better use an extended-release formula for optimum benefits. It is important to note that not all forms of magnesium have the same effects. Different forms are useful for different health benefits. We will discuss this topic in detail in upcoming videos. As a rule of thumb, avoid magnesium oxide as it has minimum bioavailability. Nitric oxide. Nitric oxide is a chemical present in the lining of our blood vessels. It makes the blood vessels relax, which helps improve blood flow, lower blood pressure, prevent plaque formation, and even repair the lining of blood vessels. Beets are a fantastic source of dietary nitrates, which can be transformed into nitric oxide. A recent study involving 38 participants found that consuming a beetroot juice supplement led to a remarkable 21% increase in nitric oxide levels within just 45 minutes. But wait, there's more. It turns out that drinking a single cup, 250 milliliters, of beetroot juice can also effectively lower blood pressure levels within 1 hour, and its beneficial effects can last for up to a full day. Other foods that boost nitric oxide production and lower blood pressure are garlic, celery, and leafy greens. We can also raise nitric oxide levels by taking supplements like L-citrulline, ginkgo biloba, and hawthorn berry extract. Health tips. 1. We need to pay attention to certain things that can deplete the nitric oxide levels in the body. There are specific bacteria in our mouth that help us produce nitric oxide. Antiseptic mouthwashes can kill bacteria, including those that create nitric oxide. Consequently, our bodies produce less nitric oxide, which is not good for our cardiovascular system. Smoking and sugar also deplete nitric oxide. 2. Diabetics beware, as beets are a bit high in sugar. Beetroot supplements are to the rescue. Supplements are also an option for people who tend to form kidney stones, or cannot tolerate the taste of beet juice. 3. If you choose to drink beet juice, better add the beet tops, the green leafy part, as well, and make it into a smoothie. Beet greens are very high in potassium, another mineral that is helpful to keep the arteries relaxed and regulate blood pressure. Potassium. Potassium relaxes the arteries and lowers high blood pressure. It also prevents heart attack, stroke, and osteoporosis. Our body needs 4,700 milligrams of potassium every day for optimum function. Yet, most of us are deficient, as we do not consume enough of it. If you always feel tired, weak, constipated, and experience muscle cramps while walking, these can be the signs of potassium deficiency. Leafy greens, asparagus, mushrooms, broccoli, zucchini, Brussels sprouts, pumpkins, and avocados are among the best sources of potassium. Another way to increase potassium intake is to add potassium chloride salt and cream of tartar to the recipes you make. Some other foods that have cardiovascular benefits and can help lower blood pressure are fish, walnuts, flaxseed, and cinnamon. Cinnamon improves blood sugar levels and lowers blood pressure by causing blood vessels to dilate. Research has shown that consuming 30 grams of ground flaxseed every day for 6 months can lead to a significant reduction in both systolic and diastolic blood pressure. It is amazing what a few simple dietary changes can do for your health. Tocotrienols and omega-3 are also important nutrients for overall cardiovascular health. They reduce inflammation, lower oxidative stress, and improve lipid profile. Now let's discuss the not-to-do list. If you are looking to control blood pressure and boost your cardiovascular health, it is imperative to cut back on starches, sugar, alcohol, high glycemic fruits, processed foods, soda drinks, juices, hydrogenated fats, gluten, and vegetable oils. This will improve insulin resistance and metabolic syndrome. Metabolic syndrome includes hypertension, low HDL, good cholesterol, high triglycerides, weight gain, and especially central obesity. Insulin resistance, which results in elevated insulin levels, is a major contributing factor to developing hypertension by causing stiff and hardened arteries, sodium retention, and potassium deficiency. Excessive caffeine intake can elevate your heart rate and blood pressure. But don't worry, there's no need to give up your beloved coffee altogether. Simply switch to decaf and your heart will thank you for it. Did you know that every time you light up a cigarette, you are not just harming your lungs, but also putting your heart under intense pressure? Smoking not only decreases the oxygen levels in your blood but also forces your heart to work harder and faster to compensate for the lack of oxygen. This increased workload can lead to high blood pressure and its complications. However, that's not all. Smoking damages the endothelium, the inner lining of blood vessels, and accelerates atherosclerosis, which are all contributing factors to the development of hypertension and heart disease. Coming to a so-called healthy food, the fruits. Fruits are high in fruit sugar, called fructose. Fructose consumption can lead to endothelial dysfunction via several different pathways that include activation of vasoconstrictors, inactivation of vasodilators, and overstimulation of the sympathetic nervous system. Endothelial dysfunction causes blood vessels to fail to dilate, ultimately leading to hypertension. High fructose diets also upregulate sodium and chloride transporters, resulting in a state of salt overload that increases blood pressure. Only stick to low glycemic fruits. Let me know in the comments if you want to know more about this topic. Lifestyle modifications for metabolic reset. Being overweight puts you at a higher risk of developing hypertension. Obesity causes endothelial dysfunction, a condition where heart arteries are not blocked, but they constrict and become narrow, and causes chronic chest pain. Endothelial dysfunction is more common in females. It is important to maintain your BMI in a healthy range. Losing even 5 pounds, 2.3 kilograms, can reduce blood pressure in overweight people. The more weight you lose, the more your blood pressure can drop. There is roughly a 1 mm of mercury decrease in blood pressure per 1 kilogram weight loss. It might be possible to lower your blood pressure medication dosage as you lose weight, or even stop it altogether. Intermittent fasting will also help lower insulin levels, decrease inflammation, and target the underlying cause of hypertension. Health tips. Did you know that the size of your waistline is a better predictor of your overall health than just your total weight? Visceral fat or central obesity, an excess of abdominal fat mainly present around the organs, is particularly harmful. It compresses your kidneys, triggers a system that causes your body to retain sodium and water, and constricts your blood vessels, all contributing to high blood pressure. There's more to the story than just shedding a few pounds. Did you know that carrying extra weight around your waistline can increase your chances of developing serious health conditions such as type 2 diabetes, cardiovascular disease, and even premature death, regardless of whether your body mass index falls within the normal range? That is why it is important to not only aim for weight loss but also target the right type of fat. By prioritizing the reduction of visceral fat and maintaining a healthy waistline, you can substantially lower your risk of developing these life-threatening conditions and enjoy a longer, healthier life. It is important to note that weight loss is all about hormones, not calories. Not all calories are equal. Calories from protein and healthy fats do not contribute to weight gain and metabolic syndrome. Whereas calories from carbohydrates induce insulin resistance, central obesity, and all of the aforementioned complications. Regular exercise typically reduces elevated blood pressure by 5 to 8 millimeters of mercury. It's crucial to keep up a consistent workout routine to keep blood pressure from spiking. A general principle is to aim for at least 30 minutes of aerobic exercise of moderate intensity 5 days a week. For instance, swimming, moderate jogging, and brisk walks. Blood pressure can also be lowered by strength exercise if done consistently for 20 to 30 minutes, 2 to 3 times per week. Lifestyle modifications for neurological reset. There is an overlooked contributor to high blood pressure. When we experience stress, our body releases hormones such as adrenaline and cortisol. These hormones make our heart beat faster and our blood vessels narrow, which ultimately leads to blood pressure rise. The good news is that managing stress effectively can play a vital role in managing hypertension. There are a variety of relaxation techniques available, such as deep breathing, meditation, and yoga, that have been proven to be very effective in reducing stress levels. There are certain breathing principles that we need to follow to effectively manage hypertension, and videos on these techniques will be coming soon. In addition to relaxation techniques, engaging in regular exercise, eating a healthy diet, and getting enough sleep can also contribute to stress reduction and help manage hypertension. Many doctors overlook a crucial lab marker when ordering blood work for high blood pressure. Astonishingly, addressing this one factor can resolve the majority of hypertension cases. Don't miss out on our upcoming videos, where we reveal what this essential marker is and how it can assist you in managing your blood pressure effectively. This little-known secret could potentially change your life. Health tips. Another very important piece of advice. Unless your hypertension is sensitive to salt, do not limit salt intake. Contrary to popular belief, very few individuals have salt-sensitive hypertension. People who limit their intake of salt don't live as long, according to studies. You can click on the links in the description section to learn more. There lies a ticking time bomb hidden within our bodies, just waiting to go off. The majority of us have pre-existing blockages in our arteries, putting us at risk for heart attack and stroke. But don't worry, there's still hope. Click the I button to watch my other videos on cardiovascular health. Thanks for watching.